afternoon, ladies and gentlemen. Welcome to the Sisu Wellness webinar on health coaching. My name is James Slater and I'm Director of Coaching at Sisu Wellness. I'm going to be talking today about the benefits that health coaching can bring to individuals and organizations. Probably going to be talking about 30 minutes, 40 minutes at the most, and we'll leave time which you can send by email, I think, or send over the system that you're using to access the webinar. But I'm also going to be taking you on a journey, and I want you to see it very much as a journey because in some ways health coaching is still at very early stages in both the US and particularly the UK. And want to try and address really what the increasing importance of health coaching as an intervention. And increasingly it can be seen to do a number of things. Help to sort of prevent and treat chronic diseases, and certainly there's some work going on in the NHS around health coaching at the moment, which I'll talk about later. How health coaching can underpin health and wellness strategies within the sort of corporate organizational world, and again be trying to address some of those issues really perhaps later in the webinar. But also to look at how health coaching can sort of underpin and contribute to individual life, and try and look at the sort of gamut of what's happening, try and look at some of the sort of benefits that can be taken from health coaching, and look at its development really in the sort of current climate. Now, I'm not here to claim it's the Holy Grail, that it's the be all and end all of answers to a lot of problems, but it is, I think, increasingly being seen as a useful strategy for tackling the mountain levels of chronic diseases that are beginning to afflict particularly the Western world and increasingly in the sort of Eastern world. Now, I've used the term health coaching for this presentation, but if you've read any of the literature, you also see people using the term health and wellness coaching, or sometimes they'll just use wellness coaching. Now, there are some distinctions. They're not, I think, important for what we're doing today, although what I will say, that health coaching is large for coaching directed at treating, helping people with chronic diseases, and wellness coaching much more around general health and wellness and helping people to manage and increase their own sort of health and vitality. So you might find yourself using them interchangeably at times, but really sort of focusing on health coaching. I'm going to start really with what is really a sort of major crisis that we've got growing, particularly in the West. In this crisis globally, and it's an increase in chronic diseases and the sort of escalating costs of treating these diseases. Now, it's estimated by 2020, 3/4 of all deaths will be from chronic diseases. And the interesting thing about these is many of them are preventable. They're also interrelated and also in many ways sort of treatable and preventable, very often related to particular sort of lifestyle issues. Now, at the moment, these diseases present a significant burden, certainly for the NHS and the healthcare service in the UK, probably spending in somewhere in the region of 15 billion plus per annum on treating these diseases. And that excludes the economic costs to the economy of things like sickness absence. So a massive and growing chunk of government spending to treat these diseases. Now, in the West, we've been very successful at developing a whole range of treatments, acute treatments, and we're on the whole very effective at treating these diseases once they appear. But we could be doing a lot more to try and prevent them. And of course, the other issue about these is the interrelationship of these diseases, and the relationship to sort of lifestyle, exercise, smoking, drinking, and also socioeconomic status of sort of people is also related to these areas. Now, there's also a significant cost to productivity in that things like obesity and chronic health conditions are probably costing UK PLC again in excess of 20 billion a year in terms of lost productivity, and that's a figure from Gallup. But if we look at some of the evidence would suggest that an employer with a significant number of health risks, such as being overweight, lacking in exercise, poor diet, we can see a number of things. Increased sickness absence. The of Shell employees showed that obese employees were 80% more likely to be absent from work than non-obese employees, and were losing 3-4 days a year over and above somebody who wasn't obese. Similar studies have attached other figures like 14 days a year. But what is clear, I think, from the evidence is that obese employees are significantly more likely to take both short-term and long-term sickness absence than workers of a healthy weight. I'm not particularly focusing on weight in this presentation, although I'll be referring to it throughout. Rather than use sort of interrelation of these chronic diseases, often related to weight, related to heart conditions, and the impact they can have on individuals and the impact they can have on sort of. Now, what's important here, and will come as no surprise to you all, is that are related to increased costs. Now, the evidence for this, particularly from the US, is very strong. The University of Michigan's Health Management Research Center have very clearly established that costs follow risks. So health costs and productivity costs follow health risks. And high-risk individuals, that's those people with 3 or more health risks, are associated with higher incidence of disability, higher sick pay, and higher number of working days. And health risks also impact productivity measures in inversion. As health risks increases, productivity decreases, and conversely, as health risks decrease, productivity improves. So there's a lot to be gained from helping people reduce their health risks and look at lifestyle issues in relation to these chronic diseases. And that's where health coaching begins to sort of drop into the picture. But we'll come to that a little later on. What's also clear, I think, is that health information and advice have limited impact. That's not to say they have no impact, and I think there's some very good examples both in the sort of corporate and public sector where health information is helping people to change behaviours. But several decades of research really have shown that sort of knowledge alone often fails to change behaviour. There was a fairly extensive study done as part of sort of government sort of insight work a number of years ago, looking at behaviour change across a range of areas, and they came up very clearly with the fact that that knowledge alone won't change behaviour, and that telling people what to do, even showing people what to do, only has a sort of limited sort of impact. And there is there's a growing recognition, and I think this is where sort of health coaching begins to come into the picture, and certainly began to come into the sort of picture in the US. Clearly very different economic drivers than, say, in the UK and sort of Western Europe. There's a growing recognition that simply telling people what to do is not effective in terms of bringing about long-term behavior change. It's not effective in treatment and getting people to be compliant with treatment, and it's not effective particularly in getting people to change their behavior. And really, health coaching comes into picture because what's increasingly come into focus really in the last few years is the importance of psychological and behavioral interventions that begin to address the underlying issues of why people change or don't change their behavior. And this recognition is causing in many sectors a rethinking of helping people to think about health-related lifestyle behavior. If we look for a minute at the 5-a-day message, which I'm sure you're all familiar with, you know, that we all need to eat 5 portions of veg a day in order to, you know, maintain a sort of healthy lifestyle. Now, first question I would ask you is, do you believe this is good advice? You know, is it advice you follow? What do you understand it to mean? You know, what constitutes these 5 a day? Do tinned fruit and veg constitute it? Do dried fruit and veg constitute it? Do strawberries in yogurts constitute part of it? And again, as we begin to sort of unpack these, what we see is that it, you know, the sort of can be quite complex, really, in terms of.
This is a rare sight indeed. We here find the male attempting to gather the offspring's favourite fruit, which, if out of season, can be more expensive. Luckily, his mate saves the day by foraging a less expensive tin of the fruit. The male then goes hunting further afield, while the female gathers the week's fresh vegetables. She is skilled in cunningly disguising the vegetables so the fussy cubs don't realise what they are eating. Now here's an extraordinary sight, a male returning from a hunt with something healthy for the whole pride to eat. Truly, this is evolution in action.
Visit nhs.uk/5-a-day for tips on how you and your family can eat more fruit and veg.
Typical promotion there from the sort of NHS. Nothing wrong with it. On one level, fairly clear message. Don't know whether, though, it's suggesting that, you know, frozen fruit and veg is as good as fresh fruit and veg. You know, there are all sorts of ways we could sort of look at that and sort of think about it. And that's part of the challenge, really, of, you know, of just approaching people with sort of information. And if you think very often of the sort of contradictory information we almost get on a daily basis from the sort of media, you know, how many glasses of wine is an acceptable drink a day? Is drinking red wine better for you than white wine? You know, there are a whole range of messages that we're bombarded with that may, you know, impact on how we think about some of these sort of health messages. And there, you know, and there lies the sort of challenge, both in a governmental, an organizational, you know, and an individual sense. Now, there are clearly some very good examples in organization, you know, of organizations running very strong health promotions and helping people to alter some of that behavior, you know, in terms of how they eat, what they eat, what level of activity, and all very important. but have their limitations really, and I guess that's where health coaching begins to sort of drop into the sort of picture. Because we have a sort of problem when it comes to changing health-related behaviour. Most of us know what we need to do to improve our health and improve the quality of life. What we don't know sometimes is where to start, or what we don't know sometimes is if we want to start, or is it worth starting? So, you know, the whole range of sort of questions that sort of come into sort of play here. There are a range of identifiable barriers as well that stop people from engaging in behaviour change. And again, I'm going to spend a little bit of time looking at these. And these barriers can be sort of behavioural, emotional, situational, think about things to our interpersonal relationships and, you know, our physiological drives as well. If I think about the sort of people we work with in sort of Sisu, about 25% of the people that sort of come into our coaching system come in with a sort of clear view of what they want to achieve and how they want to set out to achieve it. And the coach's role is often in that sense a sort of metaphorical sort of hand-holding. Often these people probably would have done it themselves without the sort of coach. They've been very clear about it and just sort of get on with it. The other 75% are really where the work is, really, and these are sort of people that need help and support through the sort of process of making the changes and through the complexity and challenges of those sort of changes. And we all carry with us what I would call a sort of world view that, you know, about what we can and can't do in terms of our own self-efficacy based on our history, our experience of achieving things, our, you know, very, you know, and sometimes that both supports and can get in the way, really, when we come to change in behavior. Our health is determined by a range of, you know, psychosocial factors as much as it is by things like infection, so that the likelihood of us taking a recommended, you know, course of action might depend on a range of things. So in the sort of traditional health belief model, our age, our social class, our social psychological status, our wealth, you know, will all impact on how we see and how we view health. Our own view about our susceptibility to particular diseases, you know, likely to be worrying about arthritis in 20 years' time? Maybe, maybe not. Be thinking about what I do now might impact on that arthritis in 20 years' time. Maybe, maybe not. And my familiarity with a particular condition, you know, if I've got a relative with a heart condition, I might be more attuned to thinking about. And all of these will impact on whether or not I'm, you know, going to think about any recommended courses of action. And our current health and current state of health is going to be dependent on these things. It's almost like an iceberg. The tip of the iceberg is our health, but below that is our lifestyle, behavioral level, the way we live our life, the way we eat, the way we interact with people, our cultural and psychological motivations and beliefs, and to some extent our, you know, a whole belief about where health sits in the realm of meaning and our life generally. And when we think about the psychological barriers to change, we may be thinking about a range of areas. Miller and Rollick, who are sort of very big in the sort of motivational interviewing, which is one of the things that underpins health coaching, were very clear when they started that very often when people are told not to do something or to do something, that human nature will probably do the opposite. So in terms of, we discount our concerns, or we discount information because we might choose to eat the burger today rather than have a few extra years tomorrow. If I told you that eating a burger every day will take 3 years of your life, will that change you eating a burger today? May or may not do. We also have something called the asymmetry of loss versus gain, that the pleasure of doing something now and losing that pleasure now, as opposed to the longer term gain of forgoing that pleasure now. So drinking wine, enjoying wine now, rather than, feeling fitter longer term. And then we have our psychological defenses. So various points that early death and things like morbidity are things that happen to other people. It's not going to happen to me. These are not things that I really need to be considering at my age, even if my age is 50 or even if my age is 60, because it's not going to happen to me. So the whole range of things then that begin to influence our beliefs about health. Attitudes are quite interesting. If you think about your own attitude to health for a minute, do you think health is something that, or is it something that you play a part in constructing? Wellness is not simply the lack of disease or simply the absence of illness. And just as there are degrees of illness, there are degrees of wellness. So wellness and health are something static, and not something static, they're something fluid, they're ever changing, they're influenced by things around us, by where we are in our life. And again, but do we pay attention to these, or are they background or foreground? Now, the sort of question posed by the sort of models in front of you there, are really, when we think about health, which way are we facing? Are we facing towards the idea of wellness and what that brings in terms of healthy, positive attitudes and a sort of sense of well-being, or are we facing towards a sort of death, premature death? And when we start to think of it in this sense, then even somebody who's physically fit, who might be running marathons, could be facing towards what I might call the sort of premature death end because of experiencing high or striving for perfection, or somebody who has a serious disease may be always looking to sort of manage that and attain the sort of best that they can in the circumstances. So these attitudes and beliefs become sort of part of that. And and these models pose for all of us a challenge. I want you to think for a moment about your own health. Is it something you actively engage in, or you don't think about much unless you get ill? Evidence is interesting. Is that only somewhere, certainly in the UK, although it's somewhere between 5 and 10% of adults engage in what you might call the top health behaviours: regular exercise, maintaining a healthy weight, eating fruit and veg regularly, consuming healthy fats, not smoking, and probably. And I think that says a lot about where we are in relation to these sort of chronic diseases that are emerging. Now, they're not just emerging because of lifestyle, they're also emerging because we're living longer, because we've been successful in treating some of these diseases, but been successful in treating some of the acute diseases. People are living longer. But again, the sort of health coaching comes into the scene because it is also about helping people think about some of these issues, as well as addressing some of the chronic diseases, helping them to think about this whole issue about sort of health and where we are into relation to this illness-wellness continuum in our lives. Health coaching really emerged in the US, and certainly is strongest in the US and Australia, and has increasingly gained ground as a successful intervention for individuals making lifestyle changes. Now, the drivers of reducing healthcare costs are much stronger clearly in the US, but it's a method of intervention that's gaining ground here in the UK. In February of this year, the NHS Commissioning Board held a summit in London on health coaching, in which they invited practitioners, particularly within the sort of health service, particularly practitioners from the US, to do some thinking around how health coaching could start to be embedded in the NHS. And, you know, and some important thinking and some important work going on, and some pilots going on in various parts of the NHS at the moment, both in terms of training nurses, begin to use health coaching models, think about sort of interventions. Now, if you ask the question of what health coaching is, there are various definitions. The most common one really might say it's a behavioural intervention that facilitates goals in order to change lifestyle-related behaviours, with the intent of reducing health risks and improving self-management of some of these chronic conditions. In Sisu, we focus very much on health coaching being about supporting individuals to change unhealthy lifestyle behaviours, and that the coach and client work in partnership to facilitate healthy lifestyle changes. And the coach does that using a number of methods, and really being able to draw on a sort of toolkit of techniques to help people think about and manage the changes of behaviour. And they are challenging. Today to sort of delve into all of these, but I want to try and give you a flavour really of some of this really, and I'm sure we'll make it subject to further webinars really. One of the things we help people to think about is where they are in relation to sort of making changes, and I want to try and bring this alive a bit. So let me give you an example of John really. Now John is in his early 40s, recently been promoted to the sales manager. He had a BMI of 32 when he joined the sort of program, and he was fairly overweight. He was 120 kilograms, if I remember. He spent a lot of time in his car. He had regular meetings over lunch, and he worked long hours. And he became concerned about his health, and he was referred to the program following the sort of medical that highlighted that he needed to lose some weight. But it wasn't the medical that prompted John to join the program, interestingly enough. Joined the program was a comment from two of his children, who said to him that they felt a bit ashamed about being on a beach with him. And it was that prompted him to join the health coaching program. Now, on the upside, John was motivated to lose weight, and he wanted to be more active. On the downside, he didn't see a way to achieve this as he led such a busy life, and he didn't see how he could make those changes. So how might we think about John? You know, if we think about this protracted stages of changes, you know, we might think John is at this pre-contemplation stage where he's thinking about changes, or we might see John at this contemplation stage. He had a very strong should be making an effort at this point in time, but wasn't sure about that. Wasn't sure what he needed to do, and as with many people, he's not given really any thought to the what or how really. Now, John's not unusual. Often people come into the health coaching with what I would call this worldview, where they might have been on diets, or they might have tried getting active during the new year, you know, when they've set themselves a resolution, and very quickly that's fallen away, and they've, you know, returned to doing things they normally do. So often coaching is about trying to help people address that worldview and begin in a different way, begin coaching, begin themselves, begin to have a vision of themselves that might lead them into doing some planning and making some decisions to do things differently. As I say, John's not unusual in that sense. Now, how does health coaching work? Well, I think I'm going to show you this quick video really to give you a quick feel of that, really. And this is from an American organization called Well Coach. But I think it captures very well the sort of spirit of what health coaches do. Now, the cartoon, I think, captures really the essence of coaching and the essence of health coaching, in that the coach brings a sort of frame, for a relationship, brings a working alliance with the individual, brings a containment around sessions and processes, manages the boundaries, and brings a toolbox with a range of techniques. Because what most clients need is, and most clients come in when they're trying to make behavior change, is some non-judgmental assistance. They want to be respected and listened to. They want to be able to trust the coach. They want a collaborative, curious approach to making those changes, and a recognition of their own unique life approach to some things, and the recognition of the difficulties of making change. Making these changes are often not easy for most of us. We're very often moving in an iterative sense from vision to action to reflection. Failure is important because, all of us in terms of learning have to fail at some point to begin to come back around that loop and make those changes. And for most individuals, they'll find what's important for them. They may start with one vision and end up in a very different place. But what's important is the growing sense of confidence and self-efficacy that comes with the coaching process. And coaches focus on that idea of confidence and self-belief with people. People come with a whole range of baggage. They may have tried diets, they may have tried going to the gym regularly, they may have tried a whole range of things that have not worked, or they've walked away from in the end because they couldn't sustain. And the challenge of coaching is around that self-efficacy. It is around how a coach works with somebody to change intention into volition, really, into something that makes a difference, something that builds in small stages to help people make those, to make those sort of changes. And that's the nature of the work. That's the nature of the work that the sort of coach does, and the nature of what we work with as coaches. Now, there's a growing body of evidence that this coaching works, really. And again, not going to try and go into it now, but if anybody's interested, it's there. Some of it sometimes is contradictory, and we're at the early stages with this, but being able to work with somebody in this way, and the evidence is increasingly that even over the phone, I'm going to talk to you about some of the phone work we've been doing, is that it does begin to make a difference to people. It does give an anchor, it does give a focus, it does enable people to sort of make some of those sort of changes. And a number of studies are beginning to sort of show this. I want to quickly just talk about sort of one project we've been working with over the last couple of years. This was with a sort of corporate client where telephone health coaching was offered to employees with BMIs of 25 plus, who, following their annual medicals, were sort of flagged to join the program. But the driver for the project wasn't just about weight change. It was about driving sustainable change so that people could make changes that they could continue with. And that would make a longer term sort of difference. Over the sort of 2 years of the project, we had sort of 89 referrals. Of the 89, 80 started, 65 completed, went through the whole program. We had a sort of completion rate of 73%, which is, in terms of industry standards, is very good. If you take it in terms of actual starters, it was 81%, and again, quite high. And again, the limited evidence around telephone coaching in this sort of health arena is that it is as effective as face-to-face coaching, and can help to anchor people into thinking about some of these sort of issues. In terms of the outcomes, just focusing on sort of the weight loss, which for many people was one of the key drivers. The average weight loss throughout the program was 3.9 kilograms, or just over 8 pounds. 14% lost 10% more 10% or more of their body weight. And that's important because we know when people are losing 10% or more, they begin to significantly impact on the sort of health risks. 70% lost 5 to 10% of their body weight, and 43% lost between 1 and 5% of their body weight. So, so some important changes, even with very light touch coaching. Most people got 6 half-hour sessions. For some people, it was slightly more frequent, shorter sessions, both interaction over the phone, via email, and supported by regular newsletters with helpful tips and sort of information. But also as important were some of the sort of secondary goals that people achieved, really, not just about weight loss, but we saw over half the group increase their activity levels. We saw a good many change their eating habits. And we saw a number of people who were telling us that they changed, they lost a lot of weight or did not necessarily become a lot more active. What they've begun, though, is to think about their health in a very different way. And thinking about their own responsibilities for their health. Give you some examples around that. Really is some good and bad examples, because don't want to say that everybody was successful here. Some people weren't. So female, late 40s, BMI of 33.6. So wanted to understand, her goal was wanting to understand why she overeats and to change her eating habits. She lost some weight during the program, although it went up and down. And towards the end of the program, she even put weight back on. But what did begin to shift for her was her beginning to understand something around the disorganization of her own patterns, and that began to lay some of the sort of foundation for making some of the sort of changes that hopefully she will make longer term. The focus of the work with her was around how she was sabotaging herself, really, in terms of getting to what I would call, the why. Why does somebody want to do this? Often it might be about physical looks, but often it might be about sort of confidence. It might be around, having the confidence to feel that you can make changes in your life. Another example of a middle-aged male in his 50s, had type 2 diabetes. His goal was to lose weight and become more active. He focused very much on changing his diet and cutting back on the carbohydrates and fatty foods, started walking regularly and swimming. And he lost a significant amount of weight and felt much better. Now, they're only small vignettes, I'm sure, but give a sense of the impact that health coaching have. So you've got the sort of benefits individuals in terms of their own health and well-being, their own sense that they can take some control of their health, their own sense that they can impact on both their lifestyle, they can impact on their their sort of wellness and take some control of it. There's a benefit to the organization in that once people start to do that, then people have more energy, they tend to be more active, and if we were able to do a much longer term study, I'm sure we might see some changes in the levels of sickness people are taking, or on their ability to sustain energy, in terms of demanding work environments. So benefits to the organization as well here. And the nature of health coaching, though, is to enable people to take responsibility for the health and to try and challenge those underlying worldviews that we carry that are leading to some of these sort of chronic diseases. And health coaching is proving to be, and I think will prove to be in coming years, an increasingly valuable tool with that. At Sisu, we're probably in the sort of first wave of seeing some of this work going on, working both as sort of with public sector clients and private sector clients and third sector clients. And I think over the next 4 or 5 years, we'll see health coaching becoming much more sort of embedded as a means of sort of intervention. Certainly in the US at the moment, some organizations are, beginning to appoint their own health coaches in-house, clearly where there's major driver in terms of costs. And those similar changes, I think, are also coming into the sort of health service, where both GPs and nurses are also seeing the benefit of helping people think, not just prescribing treatment, but helping people think about how they self-manage and how we manage our sort of lifestyles. So thank you for your time. If you have any questions, feel free to ask. You're welcome to email them in, and we'll sort of answer them as we go along.